Yeah, good afternoon, dear panelists and attendees at this webinar, which is organized by FAJIM Medicare Foundation. Welcome our panelists, Professor Lesi and Professor Onyekwere. We are also expecting two patients who have agreed, two gentlemen who have agreed to come to share their experiences with us. They tested positive for hepatitis B, and they have been getting treatment. So I hope they will be able to join us very soon. Meanwhile, before we go to the main program, let me introduce to you FAJIM Medicare Foundation. FAJIM Medicare Foundation is a non-profit, non-political, non-religious organization that was founded less than 2 years ago. And the aim is to improve the health status of the underserved communities in Nigeria through health education, screening for early detection of diseases, and promotion of healthcare, preventive healthcare programs. Our activities revolve around three core focus areas. One, we do health education with emphasis on prevention. Two, we do medical outreaches. We go to remote areas where we screen free and we treat free as well. And any person that we identify as having one illness or the other is referred, and we also follow them up. Now, we also believe that one of the reasons why we don't have access to care, to medical care, is inadequate number of medical personnel. So we said we can start by encouraging medical students. In fact, start from encouraging students from taking up medical degrees, and then encourage them, support them during their undergraduates until they graduate and be able to do something for the society. So we give scholarships to undergraduate students studying various healthcare related courses in the university. And some of our activities since we started late 2018 is that here you see this nurse checking the BP of a patient. There is a FAJIM Wellness Center that we established in Igborat, in Oyo State, where anyone will just walk in to check their BP, blood sugar, and any other. And when there is anything, they are appropriately referred. Here, I'm sitting with a woman who I wanted to, on this February, during the World Cancer Day, where we organized a screening program to commemorate World Cancer Day. And we did that free of charge for women. We did pap smear for about 60 women. It's one of them that was talking to them. And here you see me holding a microphone. It was early this year, February, when we went to Ojaba Market, somewhere in Oyo State, in Igbora, where we did outreach, free medical consultation. These are some of the people there. We gave out drugs. And then it was about the time that COVID started. So gave a lecture on COVID, Lassa fever, and also said something about cancer to them. Here, lower down, was last year when we were at the Methodist Church somewhere in Ajegunle, where we went to screen people as well. And here to the extreme right there's a meeting there. In fact, it was the week of World Cancer Day, and I went to talk to some women, the Criterion women that were having a seminar, and we did some free screening for them as well. In fact, as a result of our participation at the World Cancer Day, we were given a certificate of appreciation by the World Cancer Day organizers. And last year we had the award ceremony and public launch in November, where we gave out scholarships to about 14 undergraduates. We gave them a token of 100,000 each of them. Some of them studying medicine, radiography, dentistry, and so on and so forth. So what we're doing today about viral hepatitis is part of our commemoration of World Hepatitis Day. On the day, which was 28th of July, we had a radio interview. We had jingles in several radios in Lagos and the Ogun State. And we also said, yes, let us also do something so that we'll be able to reach more people. And that is why we're doing this webinar today. So we brought the experts to come and talk to us about hepatitis. So what's about this hepatitis? Why is it important? Over 250 million people are living with chronic hepatitis B virus infection. And hepatitis, this particular virus, it kills more people than HIV and TB. I mean, more people than HIV and TB combined. But TB, HIV, they get attention from government and funding agencies, while hepatitis does not. The other very serious part of it is that 9 in 10 people living with hepatitis are unaware that they have it. And so they stand the risk of having deadly complications if they are not treated, and also unknowingly spreading it to others. More importantly, about 90% of children that are infected with hepatitis B in their first year of life. They become chronic hepatitis B carriers, and they continue like that. Some of them develop deadly disease. Some of them continue to spread it unknowingly. And a lot of people only come to know just by chance. This poster to the right of this slide is what we put up during the World Hepatitis Day last week for Salah. And we're particular about, say, pregnant women must get tested. We must vaccinate babies at birth. We must do premarital testing. And that hepatitis C is curable once detected. And hepatitis can be deadly if not diagnosed. On that World Hepatitis Day, the Director General of WHO gave a long speech. And out of that long speech, this is what I think seems very, very important to me, and that we as individuals should take seriously, that no infant should grow up only to die of hepatitis B because they were not vaccinated. So we're here today to support global movements to eliminate viral hepatitis by 2030. So we want to raise awareness, and we have brought world-renowned experts to do justice to the topic for us. So I'll introduce our experts, and we have in the house Professor Funmi Lesi, a consultant physician and the head of gastroenterology and hepatology in the unit in the Department of Medicine, College of Medicine, University of Lagos, and the Lagos University Teaching Hospital, Idi-Araba. She was the former secretary of the Society for Gastroenterology and Hepatology. So this big name, gastroenterology and hepatology, study of diseases of the gastrointestinal tract and the liver. Was editor of the Surgeon Journal, and since 2017, she doesn't want me to say this, till now, she has been working as the African Regional Office of WHO as a medical expert on viral hepatitis. She's currently joining us all the way from Brazzaville, Congo. Thank you very much. You're welcome, Professor Lesi.
Thank you very much. Thank you.
So I have Professor Charles Onyekwere, who is also a giant of gastroenterology and hepatology in Nigeria. He's the head of hepatology and gastroenterology units at the Department of Medicine at the Lagos State University Teaching Hospital, Ikeja. Was former chairman of Surgeon Lagos State and currently a member of the Board of Internal Medicine of the National Postgraduate Medical College of Nigeria.
In some sections of the country. And then for hepatitis C, the average prevalence was about 2%, with also pockets of very high prevalence in some parts of the country, particularly some of the northern states and some of the areas bordering Cameroon. Back here in Lagos State, where we are, the Lagos State government also conducted their own survey, and they found that the prevalence of hepatitis, local governments that had high prevalence and others, and then hepatitis B was 7%. So the prevalence varies in some of the geographical parts. Particularly those who have multiple partners. And the mothers who are infected also stand the risk of infecting their babies if precautions are not taken. So these are the people who are at risk of getting infected. And then if that's hello? Hello?
Hello?
Yeah, I hope
yes.
How the message was.
Go on, please.
Okay.
Go on.
Okay, so I was just talking about those who are at risk of getting hepatitis, judging from the route of transmission. We'll talk about contaminated blood. So if you get infused with blood that is not properly screened, that is a risk, and you could get infected through receiving improperly screened blood. So there's a need to ensure safe blood transfusion. Those who share and mention like intravenous drug abusers, people who do some harmful practices, other piercing, tattoo, without sterilize their sterile equipment, also at risk of getting infected with this virus. We should practice without protection, also stand the risk exposing themselves to the virus, and the ways in which viruses are,
Prof Abdulkareem, go on. I think Dr. Onyekwere has fallen off, yes.
All right. So,
he was telling us about
how common.
Yes.
He has talked about how common is viral hepatitis. Did he say something about that?
Yes, yes. He's told us the prevalence in Nigeria, and he has told us the risks, the routes of transmission of viral hepatitis.
Okay. Can we continue with who are those at risk? Professor Lesi.
Yes.
Please continue with those at risk.
I think Onyekwere is trying to connect. All right. You know what? I'm actually going to address I just want to pick out a few things that Dr. Onyekwere mentioned. He talked about the prevalence of viral hepatitis in Nigeria, about 11%. And I just want to put that into numbers so that we can understand. So we're talking about 20 million people, at least, in Nigeria that has viral hepatitis. And this translates to 1 out of every 10 people. So if you go on the street and count 10 people, 1 person has hepatitis B or C. But before I go into that, I just want to say broadly that there are 2 groups of viral hepatitis. There is a group of viral hepatitis that is acquired from poor sanitation, from poor water, from contaminated food. And that one we call acute hepatitis, and it's caused by hepatitis A and hepatitis E. And then there's the other type that is responsible for what we call long-term diseases. And in this case, we are talking about hepatitis B and C. Professor Abdulkareem, you mentioned that 1.4 million people die every year of viral hepatitis.
Yes.
But they don't die of viral hepatitis.
No.
They die of liver disease and liver cancer. And many people out there do not even recognize that viral hepatitis causes liver cancer and liver cirrhosis. All right? So I always try to make it clear. And you know, HIV is simple. A person who has HIV, he dies of HIV. A person who has tuberculosis dies of tuberculosis. But a person who has hepatitis dies of liver cancer or dies of liver cirrhosis. And oftentimes we miss this connection. And many people do not understand when you say people die of hepatitis B. They're not seeing people dying of hepatitis B or C. So I think one of the important things is to raise awareness that hepatitis B and C are the major causes of liver cancer and liver cirrhosis in Nigeria and actually globally. So that would be the first important point to take away.
To take home. Very good.
Yes.
Okay.
And then you were going to do a poll. Maybe this is the time to do the poll.
Yes,
so
poll is on already.
Our audience will know
poll
what
is
they
ongoing.
know. Before them
On.
No,
poll is on already.
Oh.
It's on.
Oh. So let us give them time to do it, and then you show us the answer.
Yeah, we can take it up from there.
So we can see what the answer is and know where we're going.
Be able to address them.
Yes. Has it been?
So I'll give 2 more minutes.
Okay. Can we fill the poll too?
Yeah.
No, but we're not.
Okay, so you're giving the audience 2 more minutes for the poll. Okay, so they have one more minute.
So that so that we can address.
I'm looking at I'm looking at the question and answer, and one question I'm seeing here is, what are the early signs so that we can be on the watch out? Very good. So by the end of the session, I think that person, Amina Mohammed, will be able to answer that question.
Are we going to get it?
Sir? Few seconds, and then I'll end the poll.
Feedback.
Do we see the poll results? Show us the results so we can see. Wow.
So the first question says, which of these viruses is the most common cause of viral hepatitis in Nigeria? Oh, you say B. How is viral hepatitis transmitted? Sorry. And we have from mother to child.
Which is correct?
Which is correct. Unsafe blood transfusion.
80% of people.
Use of infected needle. Sharing of
Very
objects.
correct.
89%. Sexual intercourse. And then the next question says, coming. What are the, my cursor is moving too fast. What are the symptoms and signs? Jaundice is the highest there, abdominal pain or discomfort, and then others too, like fever, then no signs or symptoms, asymptomatic. A few pigs, nausea and vomiting. Then you have, how can viral hepatitis be prevented? Vaccination, 98% pig vaccination. Then 2% pig taking herbs to improve immunity. Number 5, what are the complications? You have liver cirrhosis, liver cancer, liver failure. So which of these viruses is curable? And 58% says hepatitis C, 20% hepatitis B, and then the 18% says hepatitis E. Number 7, do you know your status? 71% says yes. Number 8, if you are hepatitis positive, are you receiving treatment currently? 18% says yes. 82% say no. So Okay, so there you go.
Fantastic.
So, common signs and symptoms, Professor Onyekwere. Would you like to tell us about the common signs and symptoms of this disease?
Professor Onyekwere, unmute yourself. Unmute yourself. We can't hear you.
Okay, sorry. Yeah. It's important to appreciate the fact that a significant percentage of people who are infected with viral hepatitis don't even have any symptoms. Particularly those who get infected, they may show symptoms, and the symptoms can be very non-specific, ranging from pain, fever, vague body pains. And then it's not even there is discoloration of the eyes or the urine that people tend to febrile illness, hepatitis. Otherwise, they may get malaria and they may get treated for malaria or other flu-like illness. So majority do not have any symptoms depending on the age at which they acquire this infection. But like I said, the adults do have symptoms. The symptoms could be non-specific. And it's only when there is discoloration of the eyes or the urine that people begin to link the illness with hepatitis. That is in the acute stage of the illness. But in the chronic phase, when the infection has been going on for over 6 months, and this is actually seen in cases of hepatitis B, C, or D, you may begin to see symptoms or signs of underlying chronic liver disease. You could have changes in the nail, you could have some changes in the hair texture, you could have enlargement of the male breast, and you could have swollen abdomen or swollen legs. And some of them may actually go ahead to have other complications from what we call hypertension, when there's dissection of the blood vessels within the GI tract, and these vessels could rupture, they may begin to vomit blood or pass fresh blood in the stool. Some also end up having complications as bad as cancer of the liver, in which case the liver gets hard and they are wasted, and so the presentation varies from no symptoms at all to mild symptoms to very severe symptoms. And sometimes you could have what we call encephalopathy, where
It's up.
So let me just highlight a few of the things he has said.
Okay.
And, sometimes I look at the ongoing COVID pandemic and I wonder, what are the similarities between the ongoing pandemic and viral hepatitis? Dr. Onyekwere has talked about some symptoms.
Like fever.
He talked about jaundice and all of that. For many of us, these symptoms are a late feature of viral hepatitis. And I put it to you like COVID. Many COVID patients are asymptomatic, all right? And a small percentage develop symptoms. Now the world is going, do you need to wait to see symptoms of COVID before you test?
Exactly.
So the point I'm making here is that the symptoms of viral hepatitis liver disease are usually advanced symptoms that occur in the late stages of the disease. So one thing he said was that most people do not have symptoms. And I think the takeaway message, like COVID being mostly asymptomatic, most viral hepatitis B and C are also it's a big word, they have no symptoms. So we need to note that. So over to you,
they will feel well and okay. Meanwhile,
thank you. They feel well and
liver cirrhosis, they can have cancer.
Of course, that's why they call it a silent disease.
Killer.
The disease becomes noisy when it is late.
And then when it is late, we're very minimal. Very little can be done in terms of management. So, Professor Onyekwere, are you on? Are you back on now? Because we'd like you to take us through how do you manage people with hepatitis?
May cause fever and yellow eyes, like Dr. Onyekwere said, but 98% of these people will recover within a few weeks. Within 2 to 4 weeks, they would recover and they will become absolutely normal. So we're focusing today on the hepatitis B and C. These infections, when you get them, many people become what we call chronic carriers. So they do not recover. Although they are fully well, the virus lingers in these people, and over the course of 10 or more years, they go on to develop liver disease, and they are the ones that tend to die. So I want the audience to go away knowing that hepatitis A and E can occur because of water and food, but it doesn't cause as many deaths as the hepatitis B and C. And our focus this afternoon, I think, is on the long-term hepatitis B and C. So, yes. Our chair, over to you.
Okay, so we wanted Professor Onyekwere to take us through the treatment. What do you do for them? Those that are asymptomatic, we go out there. Part of the program, part of the activities of FAJIM is that we go to the communities and then we screen people. When we discover that they are positive, we refer them. So when we refer them like that, what do you do for them?
Yeah, thank you, Moderator Prof Abdulkareem. When somebody is infected with hepatitis B or C and are referred to us, the first thing we do is to counsel them about the nature of this infection and the long-term nature. For the C, we'll let them know there's a cure, and then we'll go ahead to evaluate them. We'll do physical examination on them to see whether they have developed liver disease and at what stage it is. This evaluation, besides the physical examination, they may need to undergo some tests, some imaging studies to find out the stage of the disease in them. And then those of them who meet criteria for treatment, there are some criteria that has already been agreed on by various professional groups, including the Nigerian Society, are going to go ahead to put them on treatment for hepatitis B, and the treatment lines basically to the injections or the tablet, but depending on your profile, you decide who gets what. But basically, most people would go on the tablets. It's only very few who would probably need to use the injection. But the tablets have to be taken depending on the stage of the disease in them. For hepatitis C, we have drugs that can cure it. So if you're infected with hepatitis C, we need to run further tests to confirm that it's not just the antibody which shows you've been exposed to the infection. Most people who've been exposed to hepatitis C will develop the antibody, and majority will persist, the infection will persist, but a small percentage will clear it. So we need to run further tests, nucleic acid tests, to know whether you still have an active infection or just exposed it and cleared it. If you still have an active infection, further examination will need to be done to evaluate the stage of the disease in you. This will determine the duration of time or the nature of the drugs. Currently, we have drugs that are broad spectrum that can cover for the various genotypes, because the hepatitis C has various genotypes. So there's drugs in a low-income setting, but we don't bother trying to find out the genotype because of cost. So depending on, but those who already have complications may need to be managed by experts who will also take care of the complications that have already developed. I was also bear in mind that they also stand the risk of developing cancer from the infection. So even when they have been cured of the hepatitis C, if they have developed cirrhosis, what they call cirrhosis of the liver, that's advanced stage of fibrosis, they may need to be on surveillance of the development of cancer in them. I don't know if that sheds light on the treatment for the audience.
Okay. You can share.
Moderator, are you there?
I'm here.
Hello?
I'm with you.
Hello?
I'm here.
Yeah.
You can share.
Hello?
Hello.
Yeah, I can hear you.
Okay. You wanted to share some slides?
No. I said, I hope my explanation on the treatment is.
Yes. Okay,
Yeah.
now, the next question, we're going to Professor Lesi now. How can we prevent hepatitis, especially this viral hepatitis B? I know this is a subject matter that is close to your heart, and we would like you to shed more light on this aspect, because they say prevention is better than cure.
Okay, thank you very much. I'm sure you can hear me.
Yes.
So before I dismiss hepatitis A and E, that is obviously good sanitation, good drinking water, hygiene, and everything to prevent contamination of food and water. So hepatitis A and E can easily be prevented that way. So let us come now to hepatitis B and C. And Dr. Onyekwere mentioned something. He talked about unsafe injection. And many of us, we think unsafe injection, and we don't know that it applies to our lives. Unsafe injection means I have a tattoo, or I have a scarification mark using the same blade. Unsafe injection means I go to the barber's shop, I'm a man, they scrape my hair, there's some blood, and they use it for the next 5 people. That is unsafe injection. So one of the first things we need to do is make sure we don't reuse or recycle needles or even blades. Pedicure, manicure, all those things that can potentially draw blood. We need to have our own private set of those equipment. So number 2 is vaccination. And to address that question,
how about the men? How about the men that go to barb their hair? What should they do?
That's what I've said.
Okay.
So I said, you go, I said, I'm a man. If I were a man,
yes, and
I go to the barber shop, and the barber uses a blade that draws a little bit of blood, there's always some cut or some bruise, and he reuses that blade on somebody else. then you can transmit infection. One of the things they say about hepatitis B, that hepatitis B is 100 times more infectious than HIV. And this is because the hepatitis B infection can remain for days to weeks on that dry blade and still cause infection weeks after. We know that HIV dies within 5 minutes, or is it 10? Prof, you will tell us. So if I use a blade and there's a blood stain or body fluid on it from HIV, in the next 5 to 10 minutes, that HIV is inactivated on the blade. But for hepatitis B,
it's not.
That blade remains infectious for many weeks after. Hence, they call it more infectious. All right? So all our young people that do tattoo, beautiful tattoos on their neck, on their back, everywhere, you carry your own blade for your own tattoo. And I think that is the takeaway message for young people. Number 2, vaccination. And I am going to use this opportunity to respond to a question that I saw on the platform. And this person asks, the person says, I have completed hepatitis B vaccination a few years ago. And now I have been diagnosed as having hepatitis B. That is a big challenge. I'm talking to whoever wrote the question. Is a big challenge that we have. Vaccination. Let me talk about vaccination. For hepatitis B, there is no vaccine for hepatitis C. There's vaccine for hepatitis B. And the most vulnerable time for transmitting hepatitis B infection is in the first 5 years of life. And that is why WHO recommends that all newborn should have hepatitis B vaccination. They also recommend that, you know, this normal EPI in the first year, that all children must receive 3 doses of their routine infant vaccination, which I know in Nigeria is given at maybe 4 weeks of birth,
yes,
8 for 10 weeks, and 12 or to 14 weeks. So in the first 6 months of life, all of us should be vaccinated to prevent viral hepatitis. All right? So that is childhood vaccination. What about adult vaccination? That is a different kettle of fish entirely. So according to WHO recommendations, the adults that should receive vaccination are high-risk adults. I'm talking about relatives of patients who have hepatitis B. I'm talking about healthcare workers. I'm talking about people who use drugs, people at risk for hepatitis B. And before any adult gets vaccinated, you must do the hepatitis B test first before vaccination. All right? Because vaccination prevents infection when you don't have it. If you already have the infection from childhood, then your vaccination is useless.
It's useless.
Because already the milk has poured, you already have the infection. So the person that asked that question, I suspect he did not have the test prior to vaccination. That's possibly the reason. Now, looking from a public health perspective, the major deaths in hepatitis are from chronic infection. So it is people who have long-standing infection that are at risk of death and disease. Now, adult infection does not often lead to chronic infection. Professor Abdulkareem, in your presentation, you said that 90% of children can become chronic carriers.
Yes.
Did you say that?
They get it from birth.
Good. So, in that same vein, 5% of adults can become chronic carriers. So, if you look from cost effectiveness, if I had a little bit of money, I would first vaccinate all babies before I begin to vaccinate adults. And before we vaccinate any adult, they must be tested prior to vaccination. Because in our environment, infection is within the first 5 years of life. I think that message should go. And while we are talking about infection in 5 years, then I would tell you that sexual transmission is not a very effective route of transmission of chronic infection. Are you understanding me?
So are you saying
yes. So I'm assuming that sex is for adults, not for children under 5.
Oh, okay. All right.
So if sex is for adults, then I'm assuming adult sexual transmission of hepatitis B does not is not a major route of chronic, I'm specifying chronic infection. All right? So just to take us to 5 things that WHO recommends for preventing or for managing viral hepatitis worldwide. 5 things. Vaccination of newborn, number 1. Vaccination of children, number 2. Number 3, blood safety. So in our blood banks, they need to test for hepatitis B and C. Injection safety. We must not reuse needles and syringes. Professor Abdulkareem and Professor Onyekwere, when we were young, remember, we used to recycle needles. They would put needle in a nice basket and put some fluid, and we reuse it. We did not know. So there is no room for reusing any sharps anymore because the hepatitis just remains in it. In some parts of the world where injection drug users live, now they are developing what they call harm reduction programs. Because these drug addicts, they share needles. So that has a higher risk of hepatitis B and C. So these 4 preventive techniques has been modeled to be the key interventions to reach a hepatitis-free future. I don't know if I'm clear.
Yes. So, but we will also want you to address the issue of, because I can see a question now, even though we are not yet taking questions yet, that what happens, because you say sexual transmission is not a major route. What happens if a spouse is positive? What happens to the partner?
I love that question, and I will make it a joke. When I was still in Nigeria, when some of my doctors see that a woman is positive, they tell her to stop every relationship with her husband of 30 years because you found hepatitis today. All right? So I think we should know that Nigeria is what we call an endemic area. And over half of us, including Professor Abdulkareem and Onyekwere, we may have been exposed to hepatitis in our past. So we have protective antibodies. All right? So although we're not hepatitis B positive, we have the antibodies in our blood that shows that in our early life, we've been exposed to it. All right?
Okay.
So one of the recommendations for WHO is vaccination of family members and sexual partners of people who have hepatitis B. All right?
Okay.
So when a man who has been married for 30 years, he's been married to the same wife for 30 years. All right? They have 5 children, and the man is tested hepatitis B today. All right? So it is likely that his wife already has had hepatitis in the past. All right? So she may not be at immediate risk of infection from that man. And one of the things you can do is you can test the woman, not for the infection, but for the antibodies or markers of infection. And of course, again, you can vaccinate that woman to be doubly sure. All right, but we need to have this in our context. Yes. So it's not a matter of saying, from today, stop. No, no, it doesn't work like that.
Okay.
Unlike HIV. Unlike HIV. Unlike HIV.
Okay. One of our panelists who was supposed to join us to share his experience with us, you know, could not, and he sent me this on WhatsApp, and I'm going to read to us. He said, is Mr. Rahim, he was supposed to join us. He said, I'm a fashion designer. I live at Ajangbadi, Ojo, Lagos State. I have been positive for 3 to 4 years now, but I was diagnosed in the last month. I got to know about the webinar on Facebook. He said it was not so easy because we asked the question, how easy was it to get treated? He said it was not so easy to get treatment due to the expenses, but thank God I was able to do it at last. So we asked again, were you satisfied with the treatment that you were given? He said, yes, I was satisfied with the treatment I was given. In fact, I am feeling better and I have now resumed work. Unfortunately, he's not able to join us to come and share his experience. Maybe we should go through some of the questions now, okay, before we go to the final question. So the question, one of it in the chat box says, good evening, sir, ma. Please, which hepatitis is curable? I think we mentioned that, but you may still need to say which hepatitis is curable?
Hepatitis C is curable with new drugs. And so they already say that hepatitis A and E are self-limiting. Those ones, even without doing much, just supportive care, the illness will run its course. So C is curable.
All right.
I make a comment. Sorry,
all right.
Professor Abdulkareem, I always like to put a caveat on that. I don't want the audience to go away thinking that hepatitis B is incurable and they are doomed.
No.
And I always like to ask people, is hypertension curable? Is diabetes
manageable?
Curable? Thank you.
Manageable. If you do the right thing.
Correct.
So the same with the hepatitis B. If you take the right step,
it is manageable.
And taking the right step at the right time.
Thank you. That's the message.
Okay. Somebody says, if you're positive, what happens if you are not? No option. Okay, it's referring to question 8 that says, have you got, do you know your status?
Yes.
If you're positive, have you been receiving treatment? So it's asking if you're positive. But if you are not,
then you're good.
Then you're good. So should you get vaccinated if you are negative?
No, I think if you're negative, I think you should do it office. If you already have the antibodies from previous exposure, you don't need vaccination.
All right. Okay, the question about preventive measures that can be if a spouse is positive has already been taken. And somebody says, what do you mean by chronic infection? Maybe you need to expatiate on that. What do you mean by chronic infection?
Okay, I think I will take that, Professor Abdulkareem. We say somebody is in chronic when infection has been there for more than 6 months. Oftentimes, it may not be easy to know when the person got infected, but there are some tests you can measure the IgG and IgA antibodies to tell you that this infection has been there for a long time. Generally, a cutoff is 6 months.
Okay.
In fact, thank you. I was trying not to use those words, but it's hard not to use those words. It's hard. But Onyekwere has said it. Hepatitis can last for years. In fact, it takes 10 years before you have disease sometimes. That duration of time is what makes it chronic. Not how severe it is, but how long.
How long it's been in the body.
Like malaria. Malaria is, we call it in medical terms, we call it acute because it's gone within a week. So that is acute.
Okay. So we go to other questions now. Can a positive mother breastfeed her baby? I think we may need to also talk about a pregnant woman that is positive. What do they do? How should she be protected from transmitting it to the unborn baby?
Okay, should I address that? I thank you for that question. On World Hepatitis Day, WHO launched a recommendation for preventing mother-to-child transmission of viral hepatitis. So I always like to compare HIV and hepatitis because HIV is something we all know about. And the HIV mother invariably may transmit to their baby, all right? But hepatitis B positive women, some may transmit and some may not transmit. So let me tell you the type of women that transmit. These are women who have a lot of the virus in their blood, all right? Because the infection can last for a long time, many people have only a little virus in their blood. And over the years, the little virus is not growing more. Over the years, their body has sort of managed it and kept the viral load, that's another word, low. Those ones don't tend to transmit. So the women who have a high viral load tend to transmit. Women who have, in addition to hepatitis B surface antigen, they have another marker called the E antigen. And those ones tend to transmit. So the recommendation is that for those women who tend to transmit, 2 options. We may need to treat them in the 3rd trimester to
What is 3rd
trimester? In the last 3 months of pregnancy, to prevent transmission to the baby in addition to giving that baby hepatitis B birth dose. That means within 24 hours of birth, that baby must receive the hepatitis B vaccine. In addition to that, that baby must receive his full childhood vaccination so that mother-to-child transmission will not occur. I don't know if that is simple.
Breastfeeding.
I can say a lot more.
So, yes.
Breastfeeding, 100%. Go breastfeed.
Go ahead and breastfeed.
There is no contraindication to breastfeeding at all.
All right. There's a, okay, we've already addressed the question of the early signs to watch out for. And there is somebody here that is sharing his experience with us. Say, where can we get the drugs, most especially tenofovir? Lutz is no longer selling to us because of non-availability. Buying from open pharmacy costs 200% more than the amount we buy from Lutz. I've not been taking my drugs for more than a month now because of cost of drugs. Professor Onyekwere, where can they get the drugs? Professor Lesi.
The drug is available. I think the COVID situation.
Professor Lesi.
Yes, please.
Even though you are in Congo, you can still give us information about what's happening back home.
Absolutely. Number one, I want to know that person, okay, let me take it back to HIV. In HIV, everybody needs treatment. Yes. All right? So anybody diagnosed as HIV will require treatment. That's a fact. For hepatitis B, only one person out of all 4 require treatment. That's 25%. So I need to know that this person asking the question has been diagnosed as one of the 25% that need treatment in the first place.
Yeah, I think from the question is like he's already receiving treatment in Lutz.
In Lutz. Okay.
Anyway, it says Lutz no longer sells.
It's just a message that, number one, I need to know that you were recommended by a doctor who knows what he's doing.
I hope so.
That you should be on treatment. That is just a general message. The second concern is, and you know what? Hepatitis B treatment is common in Nigeria, is everywhere. And it is everywhere because it is a component of HIV therapy. So the drug tenofovir is easily available in many pharmacies. So I'm going to recommend for that person to try another pharmacy.
Okay, he's saying that it's 200% more expensive.
This is COVID. That is the COVID effect on life.
Making it so. Okay, the next question. What would you... it says, how expensive is the treatment?
Which treatment?
Well, I guess we're talking about hepatitis B.
I'm aware that some time ago, Lagos State government did bulk purchasing of the hepatitis B drugs, and the patients are getting close to 2,000 naira a month. But again, it seems to have affected supply because there was nothing coming in at the point because of the. I believe as things begin to open up, this drug coming in available and because of the restriction. But I believe to open up, these drugs will become available and the cost would. Mr. Abdulkareem, are you there?
I'm here. It's like you have echo from the other line.
Actually, because one has been going off, so I decided to carry my.
So you have to turn off one.
Okay, okay, wait. Actually, because one has been going off. Okay, wait.
Professor Abdulkareem,
Okay, there's another question here that says, can someone with hepatitis B have something to do with kidney?
It's a very long distance. There is a small percentage of involvement of the kidney, but this is not very common. It's a long association.
A long-term association, not, you know.
Yeah.
Okay. Somebody says, what do you recommend should be the first step to be taken by a recently diagnosed hepatitis B positive patient?
He should see a specialist on liver disease who will evaluate him.
Okay. Say, I've seen barbers apply lighter to blade or clippers before shaving. Is it a safe measure?
Professor Lesi, maybe you can comment on that.
That is not the recommended way of sterilization. All right, so what is recommended is proper sterilization of the equipment, and it's not by putting fire to it.
Okay.
I hope that is okay.
Yes. You say, after taking vaccine, what is the duration for another checkup?
I'm not even, number one, I've said you don't even need the vaccine.
What
number one.
Checkup is it to know whether the vaccine was effective.
So maybe more information is needed.
Okay. To check whether the vaccine is effective, maybe it's talking about to check the antibody titer and see whether it's effective, particularly somebody whose spouse is positive. And another.
After the third dose of the vaccine, a month or two.
My result of viral load. After the third. How many weeks after?
A month to 2 months.
A month to 2 months. Okay.
2 months. Yeah. After the third dose.
Say my viral load is showing a lesser range and it says not detected. What does this mean?
What it means is that within the range of the laboratory, assay, but they cannot detect it. And this range varies. But I think some of the test machines you have can detect anything above 15 IU. Below that 15 IU, it is not detectable. So if it's not detected, it means either it's not there or it's less than 15 with the currently available assay.
So, Professor Abdulkareem, let me also add to that.
Okay.
And I think it is a concept I want us to clearly understand. We have said that hepatitis B, they have a carrier status, which means some people carry the virus and nothing happens to them for life.
Yes.
All right? Those ones are called chronic carriers. They carry the virus. And in those people, the virus is, can we say, is not active? Because I saw somebody put not active there.
Yes.
So people who are said to be not active, I'm using a lay term, they require no treatment if you are not active. All right? But they just require follow-up, maybe once a year. to make sure they still remain in the category of not active. The people who will tend to have bad consequences are what we call active, and they have a high viral load. I don't know how to make it simpler than that. Onyekwere, can you help me? So
I think the thing for us to understand is that this virus on its own does not damage the liver. It is the body's response to the presence of the viral antigens that damages the liver. So when you have a lot of viral particles in you, that's the viral load. The body, the immune system begins to attack them, and in the process damages the liver. Those people where the viral particles are fewer, there's nothing to provoke the body immune system to begin to attack. So these are the so-called inactive carrier. So there seems to be some bit of correlation between the amount of viral particles. Yes.
Okay, maybe you should take this question. It's a follow-up from the person that asked about tenofovir. Said when he started treatment, the viral load was 20,000. And after 6 months, the virus became undetected. Should I stop taking the drug?
No, you should not stop. Because if you stop, there may be a rebound. That's actually part of the problem we have. So you should continue until the doctors think it is necessary for you to stop. And there are stopping rules. There are things you have to consider when to decide to stop or not. Part of it will depend on the extent of damage already done.
Okay.
If the damage is severe, what we call cirrhosis, you may not stop. If the damage is not so
okay. I have this question. I say, good evening. Thanks for my neighbor. This person's neighbor has hepatitis B, and she does not go for treatment or anything. She was diagnosed 4 years ago. I want to know what risk I am into as a neighbor. How can I and my family be protected from the disease? She's a nice type that gives my children food all the time I'm not around.
So Lesi, maybe you want to talk about this.
Professor Abdulkareem, I am happy to address this question. And this your question is a common challenge we see in our clinics where our house girl or maid is positive. And I always allay anxiety that the way hepatitis B is transmitted is through sharing sharp objects. So except you and your neighbor are sharing an injection, all right? Except you and your neighbor have any relationship that blood mixes or her body fluids enters your body fluids, sexual transmission, etc., then there's no way this woman can give you infection. So, you know, so one of the things we train people who are positive to do is we train positive people to remain healthy. So we don't encourage them to share needles, to share syringes, to share blades, you know? You don't share toothbrushes, but I can use the spoon they use to eat because there's no blood on the spoon. So there's nothing wrong with sharing the same plate. There's nothing wrong with cooking from the same pot. That person cannot, the person who is positive cannot donate blood in the hospital. And that person, we advise them, if she has a wound on her skin, she should keep it covered so that blood is not all over the place because the infectious agent is her blood or semen or that kind of body fluid. So if that interaction is not there, the chances are very slim that she can infect you.
Thank you very much. Can somebody that is positive, hepatitis B positive, turn to negative after treatment?
Possible. It is possible, it doesn't always happen.
However, let me highlight many things. When I see somebody who was positive turn negative, my first thought is, where did you do the test in the first place? In Nigeria, the quality of the test is so important. All right? I remember on many World Hepatitis Day, some test results, if you put water, it turns positive. So the quality of our laboratory rapid test kit is highly suspect. That's the first important thing about that. The person can turn positive if he was just newly infected, because we said that adults who have new infections, 95% will recover. All right? That's number 2. So those are the instances where you can turn from positive to negative. And also, a small percentage of people every year turn negative. Those are the 3 situations where you can turn negative.
Okay.
I hope that is okay.
Can someone with hepatitis B, okay, who have become undetectable after viral load test, go for hepatitis B vaccine? No.
There's no.
The person is already infected.
Vaccination. If you are yes.
So I wanted to make a point also. You made a point. Let me put it again. Let me use HIV. I like to use HIV, but they're not the same. A person who has HIV is on treatment and the viral load becomes undetectable. Should he stop his treatment? The answer is no. A person who has high blood pressure and is on treatment and the pressure goes down, should he stop his treatment? The answer is no.
No.
In fact, the fact that it has gone down means that the drug is doing a good job. So you don't want to stop a drug that is doing a good job. Yes. So when you have hepatitis B, there is no treatment for 3 months. Treatment is going to be 5 years or more. It's a long-term treatment. So the person who has taken treatment for 6 months, no, you don't stop treatment.
Very good. Now, Professor Onyekwere mentioned the enlargement of left breast as one of the chronic symptoms. He said, I became worried because I noticed that most women, left breast is always larger. Any correlation?
Onyekwere, you went into that. I'm leaving you alone in that box.
Were you a particular about
male breast?
About the size? Say left breast.
No. It could be any.
Any. It could be any. So not net breast.
Professor Onyekwere and Abdulkareem, let me first say that in women, the 2 breasts are not the same in the first instance. It is the same way that your left leg and your right leg are not the same. For many of us that buy shoes, you know that sometimes one leg is a little smaller than the other. So for women too, one breast and the other are never the same. They are not identical. One may be larger than the other. And Dr. Onyekwere talked about breast enlargement, but he's now referring to males, male breasts. But the commonest cause of enlargement of male breasts is obesity. A fat, big man, Onyekwere is not big, a big fat man tends to have some breasts. That is not liver disease, that is obesity, please.
They also side
I just want to clarify. And drugs, some drugs, exactly.
Some drugs.
Yeah, some drugs. Can hepatitis B be treated using some herbs?
No.
No.
All right. I think we've gone through many of those. Let me see if there are any.
While you're going through, I think one needs to talk about the stigma that we tend to see with hepatitis for people at the workplace. I think it's an avenue to let people know that having hepatitis B does not prevent you from working in the bank.
Okay.
Your blood, your body fluid at your workplace. So I think it's an important thing, because sometimes you see people telling you that they went for prep and because they are positive, they are refusing them jobs. So I think it's an opportunity for people to know that having hepatitis B does not affect the person's ability to do his work in the bank or in some other workplaces, because except if it's a job where you're sharing your body fluids, there's really no fear of the person who is infected.
What do you mean sharing your body fluids at work? Professor Onyekwere, expatiate on how do you share your body fluid at work?
No, you're not sharing your body fluid at work. Otherwise, there's no need stigmatizing somebody who is hepatitis B. Yeah.
But you know, you talked about stigma, and stigma is a big deal. This COVID is even causing stigma. Stigma is such a human nature thing. Professor Abdulkareem, if you knew the guy beside you had COVID, you will run. So there's so much stigma, and it is related sometimes to ignorance. People don't know. So I think one of the issues of World Hepatitis Day is to raise awareness of viral hepatitis so that we can manage stigma. Do you know that in Nigeria, even hypertension has stigma? Even diabetes has stigma. Tell somebody you have tuberculosis, stigma. We work in the hospital. People who come with liver disease and cancer, they don't even tell their neighbor. Stigma. Stigma is a big issue that we need to address for viral hepatitis. I think I will
Someone wants to know whether you can treat hepatitis with supplements.
No.
Can it be transmitted through saliva?
No.
And someone is asking, preventive measure, vaccinate. Do you vaccinate a pregnant woman? No.
No.
Someone is asking us to emphasize on autoimmune and alcohol.
In fact, let me just address that. There are 2 or 3 things that activate, let me put it in lay term. A few things activate your viral hepatitis. So here we are, a person who has hepatitis B, and Dr. Onyekwere has reviewed the person and says that the person is inactive, all right? And that person is drinking a lot of alcohol. So the alcohol on the hepatitis can activate the hepatitis to cause damage. That's number 1. Some drugs can worsen your hepatitis B disease, all right? And now we know that people who are obese, they have what we call fatty liver, and that can make your hepatitis B disease worse. So people who have hepatitis B are usually advised on diets. They're usually advised on alcohol and other diseases like diabetes, etc., etc. So that is just a takeaway message that if you're hepatitis B, it is not a death sentence, but you need to be evaluated and told that you are inactive. And like I said, 3 out of every 4 people may be inactive and may not require long-term tenofovir treatment, but they require a regular follow-up once a year, etc. Okay, and that is to allay anxiety.
Yes, maybe you can lay the anxiety of this person. Say, I'm an emergency responder. Can I continue to work in the capacity? My employer asks me questions about my status every year and sometimes tell me that I may lose my job. Is there any form of protection for me? I guess maybe this person is positive.
Yes, but we need to know what type of emergency responder he is, you know? Is he in direct contact with patients and patients' blood? There are all manner of emergency responders, please. It's hard to evaluate without knowing. Including security. Security is also emergency responder. A firefighter is an emergency responder. Too.
Okay, is it
even the driver is an emergency responder.
Is it true that hepatitis B positive patients should not eat groundnuts?
I like that question. It is such a challenge. I'm going to throw it to Onyekwere to answer that question. It is okay. Onyekwere, over to you.
No, I didn't get the question.
That HB positive patients, should they not eat groundnuts?
Well, the thing about groundnut is safe, but the problem is that if the groundnut is contaminated with a fungal infection, that's where the problem is.
How do you recognize infected groundnuts?
Okay.
The one that has patches on the body.
I think
okay, let me quickly talk about it. Okay, go on. Sorry, there's a time lag. Sorry, go on.
Hello? No, go ahead. No, go ahead.
Okay, so there's something called aflatoxin. Let me just throw that on the table. Aflatoxin is a substance produced by infection, fungi. And groundnuts are commonly infected by this fungi. And this substance activates or worsens viral hepatitis. So typically your doctor will tell you, do not eat moldy groundnuts or rotten groundnuts. So that is the instruction you will be given. Don't eat moldy groundnuts. But my question always is, when I'm eating groundnut, I don't check to see if it is moldy. I just throw it in my mouth and I eat it. And if I'm eating peanut butter, I don't check to see if it is moldy. I just eat it. So I think a safe advice is if they tell you not to eat moldy groundnut, and it is impossible for you to identify moldy groundnut, then it makes sense not to eat groundnut. That is the logic behind not eating groundnut. And the mold of the groundnut sometimes occurs in the farm where the groundnut is harvested. All right? So it's not a matter of it's moldy in your house. No, no, no. The moldiness is from the farm where it was harvested. Sometimes the groundnuts are moldy in the ground before they are harvested. So since you cannot identify which is moldy and which is not, the safe thing is not to indulge in too much groundnut eating. And that would be my advice for the person asking about groundnuts.
Okay. I think we are almost getting to the end of the question and answer, but this one says, are tenofovir and livolin enough for treatment of HBV?
Onyekwere, over to you.
Well, I think people shouldn't resort to treating themselves.
Exactly.
Because you should seek a doctor to evaluate you and decide whether you need to be on treatment or not. Otherwise, the person will go and find Livolin and tenofovir. And
I want to
resistance
yes.
to the tenofovir.
And I want to tell the person that Livolin is a multivitamin. There is no magic about Livolin. It's like multivite. All right, so it's not specific for any disease, but it's just a general multivitamin, which is good also for the liver.
Okay, so somebody wants us to, either in summarizing, we should revisit the symptoms of hepatitis B.
Sorry, can I just add a quick word? Sorry, can I add a quick word? And just to wrap it up. Right now, viral hepatitis is considered a global health priority because of the sheer number of people that have the infection. Professor Abdulkareem mentioned something. You said that 90% of people with hepatitis B, they don't know that they have it.
Yes.
So there's a move now for mass testing of people to identify those with hepatitis B so that they can be managed and not present with the symptoms of liver cancer or liver cirrhosis that Professor Onyekwere would have us. And what the World Health Organization and the global community, they believe that it is possible to eliminate viral hepatitis in the next 10 years if we do certain things. And one of these things is to make this problem a public health problem. And when I talk about public health problem, you know how Nigeria has addressed HIV. They have made HIV clinics where people can access treatment and care for free. They have made tuberculosis clinics where people can access care for free. We have malaria where people can access care for free. So the plan or the hope is hepatitis B and C can be part of a government-funded public health system so that everybody can walk up and do a free blood test, just like we do for HIV. I guess that everybody on this program has done an HIV test somewhere. The way the HIV test is done is exactly the same way hepatitis B and C testing is done. So the move for the world is to improve access to everybody for free testing and maybe subsidized or free treatment. And the reason I'm saying this is that if there is a national program, then the government will be buying wholesale treatments. The government will be buying hundreds and thousands of tenofovir. And when the person buys tenofovir, he will buy it at 1,000 naira. But now, it is not the government buying it wholesale. Different people are bringing in 5 here, 10 here, then they can sell it at 20,000 for all we care or for all we know. So the move to improve access to health, and then we need to train healthcare providers, people like Professor Onyekwere. You are going to have to go to Lesi to see him. And there are 20 million Nigerians that need to be evaluated. All right? So we must have a system where people can get tested and then referred to appropriate care at various healthcare levels. Even in general hospitals, we should have treatment or somebody who knows how to manage these patients. And that way, we can reach a hepatitis-free future in the next 10 years. And I think I would use that to wrap up what I want to say, that hepatitis B and C is beyond individual care now. It's a public health priority, just the way COVID is. And the way people are doing COVID tests We should have people also doing hepatitis tests, HIV tests, TB tests for proper care and receive the care that they need. And I thank you very much for inviting me to this show. I hope the message is clear. Hepatitis can be managed. Hepatitis C can be treated. And we need all these people that are positive. We need you, because no one person can fight this fight. Professor Abdulkareem cannot do it alone. Onyekwere and all the specialists cannot do it alone. The people who have hepatitis B, they need to begin to speak out, because that is what we call advocacy. The HIV people, they did it and they demanded care. So we need hepatitis advocates to begin to speak out and demand for care. That way the services and the prices will go down. Thank you very much.
Thank you very much, Professor Lesi. We are very grateful. It's been a very illuminating session today. Professor Onyekwere, you want to give us your parting?
Yeah, I think on a final note, I want to thank you, Professor Abdulkareem, for inviting me to this program. But I want people to know that those 290 million people who are not aware, she has talked about their advocating. They need to advocate after they have known their status. So if you don't know your hepatitis status, go somewhere and get tested.
Yes.
Do you understand? So when you know your status, you can know whether you're in this group that is infected or whether you're in the group that need to check further their vaccine status, antibody status, or whether to get vaccinated. So start by knowing your status and ask somebody near you about his or her status. That way, everybody will get to know his or her status. You can identify the 90 million people, and they can be linked to care, and they can also begin to do advocacy in the management of this disease. So I think there's also a need that there is no need for stigmatization. We have ideas on how this virus is transmitted. So except if you're sharing such intimacy in sharing body semen, body fluid, there is no need to stigmatize somebody who is infected. So I want to thank Professor Abdulkareem and her foundation for inviting me. And I think I urge everybody to know his or her status. That way we can, work towards a hepatitis-free future and make the 2030 date a reality. Thank you for inviting me.
Okay, just before you go, I have two people that have raised up their hands. Just give me a few minutes to allow them talk. Mrs. Ogunawa, you can talk. You have to unmute yourself. Mrs. Ogunawa.
I have unmuted, ma'am.
Okay, so you can talk. You raised up your hand.
Okay,
yes, I did. Now, I don't know. Can you explain to me when you say you want a patient to go for ultrasound guided true cut biopsy of the liver?
I'm not sure we talked about that here.
No.
Okay.
We didn't say that.
Okay. I just wanted it to be like, I just want to know.
There are other evaluations that have to be done before they determine whether the person requires a liver biopsy or not.
Okay, like the blood test.
Yeah. Okay, Kazim, can you unmute yourself and speak?
Thank you very much.
All right, ma. Thank you for joining us, Mrs. Ogunawa. Kazim, I'm sorry, I'm just seeing all these. Hello? Unmute yourself. Alaja Popola, you raise your hand. I think we can only take maybe one or two so that we can call it a day. Alaja Popola, unmute yourself. You want to talk? Okay. All right, so it's really been...
Sorry, I think I'm able to unmute now.
Okay, right.
Thank you very much for the education. But like Dr. Lesi said, I think we need to do more by way of letting people know, because I will tell you, there are a lot of people out there who have this challenge and who did not know. And I remember that there was a time a family friend was to take somebody, and one of the staff members. So, and the test was conducted, and the person said, "Oh, I will not be able to work with this person." No. In fact, the way he painted it to me then was as if it's a grievous thing that cannot be cured. That is worse than HIV. So we must. I was talking with the person. Say, why were you so close with him, with her like that? You don't have. So please, I think we need this information. It is a lot of people are close to us that may have this thing. We may not even know. One may, except for those people that do tests, that consciously engage in taking the test. A lot of people around you might have it, and you may not know how it can affect people around you. So thank you so much. May God continue to. Well done, sis.
Thank you. Sorry, this particular question, I must take it. Otherwise, they won't allow me to sleep at home. How often should patients who are asymptomatic visit the hospital?
Well, you may probably give your appointment once in a year or once or twice in a year.
All right. Okay.
1 to 2 times in a year. Yeah.
All right. So what is left for me is to thank you on behalf of the FAJIM Medicare Foundation. To bring out 2 big internationally renowned professors, because when you talk about viral hepatitis in Nigeria, you mentioned their names. These are foremost names. Their names will come as, the first 5 names in Nigeria. So I'm getting this on a platter of, if we had to pay, if FAJIM should have to pay for this, then the owner of FAJIM will be. So I want to thank you again.
Bankrupt.
Yes, we'll go bankrupt. That's the word. So I want to thank you again for, because we were supposed to do this on the hepatitis day itself, but these people were busy with one, program or the other. And Professor Lesi was there moderating for the WHO session on that particular day. So you can imagine people who are not here, what they have missed. And for those of us that are here, please let us let us pass on the message. It's important that we know our status. And then when we know our status, let us take the right action and then not limit it to ourselves, but preach the gospel to everyone that we come across. No one should die, or no child should die because he should have been vaccinated, and nobody should have liver cancer when it could have been prevented. I thank you very, very much again. Professor Lesi,
thank you
say
so
hi
much.
to the people in Brazzaville for us.
I will do so. Thank you so much.
You're welcome.
Thank you for inviting me. It was a real pleasure to be here. Dr. Onyekwere, it was great talking with you and sharing this platform with you. I am so grateful. I say thank you very much.
Thank you very much. Thank you again.
Okay.
All right. You're welcome. Bye.